Transax Healthcare, empowering doctors to provide the very best in medical care, setting the standard in general practice medicine, state-of-the-art medical centres in high-traffic shopping precincts. Transax, helping doctors help patients.
The number one core value of Transax is to help doctors above all else. We train, hire and fire our staff based on this premise, and we offer GPs an exciting opportunity which incorporates complete flexibility, no lock-in contracts and exceptional earning potential because we build our medical centers in high-traffic shopping precincts. A minimum hourly rate and a full appointment book. This is how we empower our doctors. I'm Peter Székely, this is my company and I'm proud of it.
Transax opened its first medical centre in busy Cherrybrook Village in Sydney's northern suburbs, where patient numbers quickly showed dramatic increases.
What we've got here at Transax is a setup where we're bulk billing and we've got a great patient location. So it's led to a great growth with our patient numbers. The fact that we're in a shopping centre really does help with our numbers. It's led to full appointment books for our doctors, and our doctors are very happy.
Medical centres quickly followed in the nation's capital Canberra and nearby Queanbeyan, the Hyperdome and Riverside Plaza shopping centres chosen for their prime location and heavy foot traffic.
Well, in the short time we've been open, we can easily say 1,000 new patients a month, and that's because of the location. If you're on a street somewhere or on a corner somewhere, it just wouldn't happen. The foot traffic you get from being in a shopping centre is absolutely crucial.
You know, it's convenient here, there's plenty of parking, always in a shopping centre you'll have parking. If we're really busy and the doctor's running behind, you know, they could pop out and have a cup of coffee or go to Coles and get their groceries. So, you know, they're happy when they come back. Doctor's not stressed out because he's running behind, so everyone's happy.
It is because of the shopping centre, because people are walking past. The bulk billing sign brings them in, but then the doctors and the nurses and the way that everybody works here keeps them out.
Doctors have found their way to Transax medical centres from all over Australia and around the world. Nigeria, Zimbabwe, South Africa, Britain, Hungary, Sri Lanka, India, China and Iran. Professionals with varied backgrounds in hospital systems and general practice.
I mean, I just come to work and everything's all set up. There's, all these, support structures are there, and all I need to really concern myself is just looking after my patients. And from day one, that's what happened. And I must say, yeah, that's a very sort of good opportunity.
It is small, compact, efficient, and it is very doctor-friendly.
As I say, they can choose their hours, they can, holidays, it's up to the individual. I have quite a lot of holiday. It's absolutely no problem at all. Yeah, very attractive. Because no admin, they can come in, they can go out, they can work when they want, they can book their holidays when they want. I mean, obviously we wouldn't like everyone to be on holiday at the same time, so there's a little bit of cooperation there. But no, I can't see any big drawbacks really. I think it's a very easy way to slip into general practice, if you want that sort of phraseology, into this country. Yeah.
I didn't experience this kind of support in other clinics and other company because of that I chose Transax. I found it very supportive and helpful.
Large medical centres are now a common sight around Australia. Competition for the services of doctors is fierce. There are only around 35,000 practising GPs out of a total of 102,000 medicos in the country. Recruitment of overseas doctors is essential to prevent shortages and maintain a high standard of medical care. So why work for the Transax Medical Group?
At Transact, we don't have the lock-in contracts. That's a great part of our deal. So we can make any decisions when we need, but it gives us space to work with freedom. I think that's very important, especially a doctor who's moving to a new country. When they find that they have the freedom to make decisions, I think that's very important.
So here we don't have a lock-in contract with the Transact model. We want to empower doctors by letting them work as many hours they want, as little hours as they want. Doesn't matter what time of the day or the evening. We're open to it all. So there's no lock-in. It's negotiable. Everything's negotiable.
Obviously, as a mother, I have my children. I have to attend to their school. I have an appointment this afternoon, so I can say, look, can I go early? But I will do a longer day on another day, and it's very flexible. I have done after hours at the beginning because we are open from 7:30 in the morning till 9:30 at night. So we can work around our hours that we can work. It's very, very flexible.
Like many of her colleagues at Transact, Dr. Nirmali Rodrigo, originally from Sri Lanka, has worked in hospitals and general practice around Australia. Adelaide, Bendigo, Dubbo and Gilgandra. A busy doctor and mother of two, she prizes the freedom offered.
The good thing about this unlocked contract with the Transact, we can take leave, we can go on holidays if we want, we inform them in advance, and so that's a big advantage, especially when you are with a family and plus when you're away from your home.
How does it feel?
It's a bit tender.
It's a bit tender.
Yes.
Okay. I don't think you break a bone.
Dr. Deli Babalola qualified as a doctor in Nigeria before travelling to the Caribbean and practicing in Jamaica and Barbados. He came to New Zealand and Australia 10 years ago.
As compared with the other practices, it's bulk billing. One, we open on weekends. We open late. It's a 7-day practice. I mean, Monday all through to Sunday. And the fact that the staff, generally from doctors to receptionists and all the other people in between, they're very friendly, very knowledgeable, caring, and very professional.
The big draw card for many doctors who've come from overseas to practice medicine is a unique and relaxed lifestyle, the acceptance of the people, and above all else, the benefits and future Australia offers their children.
Canberra is a small city which appeals to a lot of doctors. The schooling here is great if they have children. It's very family orientated. There's a lot to do. We're very well positioned, close to the snowfields, close to the beach. There's a lot to do in Canberra. It's definitely a nice place to come if you're coming from overseas.
I think Canberra is very cosmopolitan, and I must say, since I've been here the past 6 months, I've really had the opportunity to look after people from various nationalities, various cultural backgrounds, and again, it's always a learning process. It's how to deal with patients and what their expectations are. And it's always, each day you learn something new.
Our highly qualified doctors have broad experience from all parts of the world. It's a veritable United Nations. They've come to Transact because we can help them in every way, from arranging low-cost loans to help with their relocation to full appointment books in a short time. We can give them flexibility and exceptional earning potential that other healthcare operators just don't or can't.
Transact Healthcare, an exciting choice for GPs.